The heart is an organ within the circulatory system that is made up of cardiac muscle tissue. The heart functions in pumping the blood that is received from the veins through the arteries to the rest of the body. The heart is about the size of the fist and is located in the thoracic cavity behind the sternum and just above the diaphragm. The heart is divided into 4 chambers, 2 atria and 2 ventricle. The right atria receives blood from the veins and pumps it to the right ventricle. The right ventricle receives blood from the right atrium and pumps it to the lungs. The left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle, and the left ventricle will then pump oxygen-rich blood to the rest of the body. As blood flows from the rest of the body to the heart, it uses the vein known as the superior and inferior vena cava. That vein will carry the oxygen-poor blood and carbon dioxide-rich blood from the rest of the body into the right atrium of the heart. As the blood flows from the rest of the body to the right atrium, it will then flow from the right atrium to the right atrioventricular valve, which then will flow to the right ventricle, and from the right ventricle to the pulmonary semilunar valves, and then into the pulmonary trunk, which divides into the right pulmonary artery and the left pulmonary artery, and then the blood will flow to the lungs. Blood flows from the pulmonary veins in the lungs into the left atrium, and from the left atrium it flows from the left atrioventricular valve, and then into the left ventricle. Then the blood flows from the left ventricle through the aortic semilunar valve and into the aorta, which sends blood to the rest of the body. The aorta then branches into arteries, which carry oxygen-rich and carbon dioxide-poor blood away from the heart. Then those will branch into arterioles, and then into capillaries, and then from capillaries to venules, and venules to veins, and the veins will function in carrying oxygen-poor and carbon dioxide-rich blood back to the heart. Systole is known as the contraction phase of the heart. During systole, both atria contract together and push blood into the ventricles. Then the ventricles will then contract together and push blood into the arteries. The second phase that the heart goes through is known as diastole, and this is the relaxation phase of the heart. During diastole, all 4 chambers of the heart are relaxed, and the AV valves are open while the semilunar valves are closed. And then the most common chronic disease that is associated with the heart and circulatory system is known as cardiovascular disease, and it is the leading cause of early death in the United States as well as the rest of the world. Because cardiovascular disease is the leading cause of early death in the United States and is also the most prevalent and common chronic disease, it affects almost 125 million American adults, which accounts for 48% of the adult population in America. Cardiovascular disease is associated with many risk factors that will raise red flags. Of these risk factors, the most common risk factors are arteriosclerosis, physical inactivity, obesity, diabetes, and smoking. Approximately 18 to 22% of the United States population smokes. This can lead to cardiovascular disease because it speeds up the process of arteriosclerosis, as well as increases heart rate, blood pressure, and decreases HDL cholesterol. It also causes a 3-fold increase in sudden death following a heart attack. The most common risk factor associated with cardiovascular disease is known as arteriosclerosis. Arteriosclerosis is the buildup of atherosclerotic plaque in the walls of the blood vessels, which narrow the diameter of the blood vessels, and this can lead to clots known as thrombosis, emboluses, and thromboembolism. Another risk factor associated with cardiovascular disease is hypertension. Hypertension is classified as a systolic blood pressure of 180 or higher and diastolic blood pressure of greater than 120. High blood pressure makes the arteries less elastic, which decreases the flow of blood and oxygen to the heart. Diabetes occurs as the result of insulin resistance. The immune system attacks and destroys the insulin-producing cells in the pancreas, and instead of being transported in the cells, the sugar builds up in the bloodstream. This causes damage to the arteries, kidneys, and nerves. Obesity is one of the biggest risk factors that is associated with cardiovascular disease. Obesity is calculated by using a person's body mass index. If an individual has a body mass index of greater than 30, then they are considered to be obese. In the United States, If an individual has a cholesterol level of greater than 240 milligrams, there are more LDL cholesterol in their blood than HDL cholesterol in their blood. This is a bad thing because the HDL cholesterol acts as a scavenger and removes cholesterol from the blood and prevents it from attaching to the arterial walls and forming arteriosclerotic plaque in the arteries. An individual may develop cardiovascular disease as a result of physical inactivity, where they participate in prolonged periods of sitting or sedentary behavior that can be associated with deleterious health consequences. In the United States, 50% of an average person's day involves activities associated with sitting, such as watching television and scrolling their computer. When a person is diagnosed with cardiovascular disease, there are many other health problems that could arise as a result. Of these, the most common are myocardial infarctions, also known as heart attacks, aneurysms, and strokes. Myocardial infarctions, also known as heart attack, occur when part of the heart dies due to a lack of oxygen. Part of the heart dies because there is a blocked coronary artery. These begin with something that is known as angina pectoris, which is another one of these health problems is known as a stroke. A stroke occurs when a cranial artery, which is an artery in the brain, is blocked or the artery will burst. When the artery bursts, part of the brain dies due to a lack of oxygen. Some of the symptoms are numbness of the hands or face, difficulty speaking, and an inability to see out of one eye. Another health event that can happen as a result of cardiovascular disease is known as an aneurysm. An aneurysm is a ballooning of a blood vessel, most often in the abdominal aorta or blood vessels in the brain. Atherosclerosis and hypertension will weaken a blood vessel, and thus will cause the ballooning, and the blood vessel will eventually rupture. If a major artery ruptures, death can result.
Since cardiovascular disease is so prevalent, there are medical treatments that can help individuals with these disorders. Some treatments include treating clogged arteries like coronary bypass operations, gene therapy, and angioplasty. Lastly, a balloon angioplasty can help unblock a coronary artery. This does not require major surgery, but instead a catheter with a stent, which is a small mesh cylinder, is inserted into a clogged artery. A balloon within the stent gets inflated and the stent expands. Once the stent is in place, the balloon is deflated and the stent is now. Newer treatments like gene therapy use the injection of a gene for vascular endothelial growth factor that induces the growth of new vessels. Another treatment used to treat cardiovascular disease is coronary bypass surgery. This operation involves taking healthy blood vessels from the leg, arm, or chest and connecting them beyond the blocked arteries in the heart. This redirects or bypasses the blood around the clogged artery to improve blood flow to the heart muscle. Diet is also an important risk factor in heart disease. Food-related risk factors include high blood pressure, obesity, diabetes, and a diet in high saturated fats. A low sodium and low saturated fat diet can reduce the risk of developing heart disease. Also, high amounts of proteins and high fiber are important in your diet. A diet should avoid high amounts of salt, sugar, and refined carbs that are in food and drink. Physical activity and fitness levels are inversely associated with the risk of premature mortality and many chronic diseases such as cardiovascular disease. That maintain or increase muscular strength and endurance at least 2 days a week. Physical activity can include light exercises like walking, jogging, or hiking, or even more vigorous activities including swimming, running, or weightlifting. There are many cardiovascular